In this video, we explore advanced treatments for trigger finger and related conditions.
As well as amniotic fluid injections. Um, Here we have the two tendons, the digitorum superficialis and the flexor digitorum profundus, right underneath it. And here's an injection. It's a little hard to see the needle, but it's coming in from the left. And we're just getting the needle into the tendon space. It's right there. It could be a painful shot. Okay. Oh, sorry. Controversy. Or maybe, well, it was a large meta-analysis basically showing that it doesn't work. Clinically, I've seen the opposite. I've seen amazing results. People who failed the Achilles tendon injection, steroid injection, suffered for a long time, within a few months, cured. So I don't know what the people who do their research on this particular body part, what mixture they're using of PRP, what their technique is. But basically, according to some of the meta-analyses and studies I looked up, they say it doesn't work. That being said, I still think it's ethical and safe to try PRP before a steroid shot to the Achilles tendon. So this is more of the pathological evidence that it works. This is not clinical evidence in this study. And so they're questioning the widespread use. Does anyone here do PRP for the Achilles tendon? Okay, so here's another study supporting the use of PRP, saying it's better than steroid for the plantar fascia, which I'm not surprised about. Level 2 evidence. Another study, there's a randomized controlled trial, 90 patients. And another study, 60 heals. And at 12 months, patients were improved, and this was statistically significant. Wrapping up with the hip joint, you see the X-ray image here. You see the femoral head and the neck under ultrasound. You need to just put your needle somewhere into the capsule. You're not basically aiming for that, right? We're not aiming for that. This is a ball and socket joint. We're aiming for this. Okay, I'm just doing a steroid injection here, just showing you the technique. I use a 25 gauge, 3.5-inch spinal needle. I find it's less painful. It's actually a sharp needle, but I've, thank God, never seen any nerve issues by using this needle. It's not meant to be very echogenic. It's not one of those special anesthesia nerve block needles, just a very cheap, basic needle, which gets the job done.